Well, I think we're online, and I'm Gustavo Tolosa. This time I'm broadcasting from a long way away from the US. I am in Cordoba, Argentina. It's winter here. I'm in a coffee shop. So there's a little bit of environment noise. I'm going to turn off the microphone every now and then. But Dr. McDougall and I wanted to go ahead and do this webinar for all of you. So without further ado, how are you, Dr. McDougall, all the way around the world?
Great. And I tell you, it's okay that you and I took a vacation. Yeah. Trevor Noah of the Daily Show took a break this last month, and Stephen Colbert of what is it, the Today or Tonight Show, or he took a break. He took a week off, and John Oliver, and and they didn't even tell anybody they were going to do it, to take a week off in July of 2017. So I think it's good that you and I took a week off, and I'm sorry, we missed you. We really missed you. But you are having a nice vacation with your family, which you well deserve. And I had a nice vacation too last week. I got to spend 5 days with 7 grandchildren in Michigan, and that was fun. In fact, I haven't seen all the grandkids together in a while, and I've not seen them have that much fun. My grandson Sam, at 5, he said several times, he says, "I'm having so much fun, Grandpa." And they did. It was good, and it was good for all of us to be together. And we missed you, Mary and I. We did miss you, and we're going to try and make sure the webinars. Mary, there you are. Come on in. What's today? August 3rd, 2017.
August 3rd.
All right, you got to get over here a little bit and say hello.
Hello.
Oh,
hi, Mary.
Was it a great week?
It was a great week.
Yeah. It's nice to see you all.
Man.
Yeah, a little.
Man.
Yes, having a great time.
The best part was being with all the grandkids.
Oh, yes, I imagine.
We were with Carol.
Carol.
You guys all know Carol when we call the office. And we were with Carol and all of our sons, 2 sons and daughter, and 7 grandkids, and you and I, and
husbands and wives, and
yeah. So we were pretty much all together last week, and it was a vacation. But I did have my computer. I did.
You did work.
The last time you and I had a vacation was, where I didn't have my computer along.
No, but I bet you're going to tell me.
It was 2008.
Where were we? Oh, on the boat.
On the boat on Cocos Island. That's the last time.
That's right.
I've taken a vacation in 2008. So it's been 10 years, and I didn't take one really last week because I was in contact with you by email, and I spent a little time thinking about the newsletter that came out yesterday, August 2nd, 2 days late. Sorry. A little bit thinking about it, but I tell you, I just couldn't keep my mind off family and the fun and so on. And I hope you enjoyed that newsletter. But it did finish. It went out August 2nd, 2017.
You're not late very often.
Not too often. And
no, we forgive you.
We got the webinar going again. You wanted to tell people that we're having the August program, which starts a week from tomorrow, 2 weeks from now.
A week from tomorrow.
Think so?
Yeah.
That's soon.
Yeah, that's soon.
So we run a 10-day program in California. Sorry, it's sold out. It's been sold out for over a month. But then our next public 10-day program is December.
Yeah.
But we have a really good opportunity come up in September, and I don't remember the date.
I don't remember the date either.
Okay, we're having a weekend. There'll be
they just have to go online, and it's there.
Yeah, drmcdougall.com. And there's a room for the weekend. It's the least expensive, most powerful personal message that Jeff Novak, Doug Lyle, Mary McDougall, John McDougall, Heather McDougall. Gustavo, are you going to be there? Oh,
Yes,
are you going to be there?
yes, I will be there.
So
And we'll be there.
we'll be there. Everybody there. So that's the next September of 2017, and I don't remember the days.
This is the 3-day weekend.
3-day weekend. That'll be a lot of fun.
Yeah.
Anyway, we're back. We're back to work. I am so happy. Isn't that what Sam said?
Yeah. I think he did.
I think it was that.
I am so happy.
I am so happy. Yeah, he's 5. And the rest of the kids, all the way from 2 to 13, they had the same pleasure. It was good.
He was just able to express it.
He couldn't keep it quiet.
You know, he just sat there and just, I am so happy. So wouldn't it be nice if we all could say that? Walk around during the day and say, I am so happy.
Well, you and I can.
Yeah.
Unfortunately.
Yeah.
Okay. Well, thank you for saying hello. And I have
thank you, everybody. It's good to see you all again.
I have a few obligations.
And hopefully we'll see you in September.
Yeah, at the 3-day intensive weekend. Everybody will be there.
It'll
be a family event. It'll be a nice time to share our patients. There's some medical care available for our patients. And those are the people who've been through the 10-day program. That's the only people that we see are those who've been through the 10-day. And so if you've been through the 10-day and you'd like some additional help, follow-up, refills of your few pills that Dr. Lim and I give out during the September weekend, we do that also, but only for people who are patients. And it'll be fun.
Yeah. Okay.
Right.
I'll leave you to it.
All right.
Have fun, everybody. And it was good to see you all again.
Yeah. All right. So Gustavo, can you say that I am so happy you're having so much fun with your 2 daughters and son, or not? Just your 2 daughters?
I am here in Argentina with my 2 daughters. Yes, my son couldn't make it, so I'm here with them.
Are we going to see you? I know we're going to see you in August during the 10-day program.
Yeah. Next week, I can't believe it. Next week, I'll be there.
We're going to see you in September too.
Yeah.
Oh,
yeah.
Well, anyway,
yes.
That'll be great.
Yes. And I want to just reiterate for some people that have logged in late that there is a little background noise, but it's because I'm in Argentina and I'm in a coffee shop that has really good internet connection, but there are people here. So I'm going to turn on the microphone and let you, Dr. McDougall, do your
Thank you very
job.
Much.
Okay.
Excuse me, just a moment. I really miss talking to you. And
yeah, I really miss seeing everybody here and seeing you and Mary. It's always the highlight of the week. So, but it was a good break also.
Well, we left a few people mad. I did at the last webinar we had, which was probably 3 weeks ago. I don't know who's counting. Because I gave you a lecture on how Alzheimer's disease is caused by chronic aluminum poisoning. And by the way, this newsletter probably went to 100,000 people at least, maybe lots more. And nobody has questioned what I said. Not one contradiction, and probably because I'm right, and because the evidence I gave you to show that Alzheimer's disease, that dementia, is due to chronic aluminum poisoning. And so I wrote last month's newsletter, which is right here. This would be June, so it would be, in real terms, 2 actual months away, titled Alzheimer's Disease is Caused by Chronic Aluminum Poisoning. And but I had written this before, back in 2004. Basically the same thing. I just gave you an update and showed you 2004 so that's 13 years later. Nothing's changed. Nobody's questioned, at least to me, that aluminum causes Alzheimer's disease and that it's entirely preventable. And I believe that it can be slowed. The damage is actually permanent scar damage. The Alzheimer's lesions are scar damage. Here, I showed you in the newsletter what they looked like. So you can go back to the June newsletter. You can show the brain, see the brain pathology, which is pathognomonic. That means if you see these lesions, which are neurofiber tangles, and senile plaques, I can't show you too close, but they're right there. If you in the June newsletter at drmcdougall.com, June 2017, when you're looking around in the brain, usually at autopsy, and under your microscope, you see these neurofiber tangles and senile plaques, then you see Alzheimer's disease. It's pathognomonic, which means when you see this pathology, you can name the disease. Now, I also pointed out in this newsletter that there are over 1,000 papers on this subject you can find at PubMed.gov, 1,000 papers. And two of the most important findings to me, I talked to you about two, which was the 1980 publication in The Lancet, which showed that when you look more deeply into these neurofibril tangles with an electron microscope, you find that they have a central core of aluminum. You don't have the neurofibril tangles without the aluminum silicate, the aluminum central core. Okay, so if you don't have the aluminum in the brain, which, by the way, aluminum is not supposed to be in the body. This is a modern phenomenon of the last 100 years. And you can read about that. But if you find these neurofibril tangles and you have the opportunity to look deeply, they have aluminum inside of it. Without the aluminum, you don't have the neurofibril tangles and the senile plaques and all the other markers that are shown related to this disease. Tau proteins, etc. There are a whole bunch of things that are related to disease. You don't have them without the aluminum. So I don't know how you can come to any other conclusion than that Alzheimer's disease is a direct consequence of aluminum poisoning. Take the information, do with it what you want. I could not put together all the sources of aluminum, but they're as varied as aluminum cans and spray antiperspirants and drinking water and so on, but they're not that hard to find. Now, what I left you with is the message to stay away from aluminum. Aluminum, yes, stay away from aluminum. Don't eat it, and especially don't breathe it, and even don't get it on your skin. You can do that. It's not that hard. It just takes a little effort. We haven't used aluminum pots and pans in our home for an awful long time, and we don't use any aluminum cooking utensils at our clinic where we run our programs, where you will have breakfast, lunch, and dinner if you signed up for August 2017 10-day, or you'll have breakfast, lunch, and dinner with us during the September 3-day weekend. We will not expose you to aluminum, mostly out of principle. Okay, so I left you, and I don't mean to be a trickster, but I left you with another thing that you could do, and this has been published in the Scientific Research, and it was actually based on the second major impact to me, the first being discovering with an electron microscope the central core of aluminum, published in 1980 in The Lancet. But the second thing was published this year, and it was about how Alzheimer's disease, the incidence, the severity, can be directly linked to the amount of aluminum in the body. Yeah. That was published in 2017. And again, there are 1,000 articles, but those were the two most impressive. And I left you with the thought that you and I are full of aluminum. Hopefully, I have less than if I wouldn't have known what I just told you. And then I left you with the thought that there's a way that you can help rid your body. There are a couple of ways. One's desferoxamine, which is an injection, which you're going to have to put some effort into getting. And that's discussed in that June 2017 newsletter. The second was a simple way that I had recently learned about, and that is to consume some mineral water. Now, first of all, before I say this and tell you what I meant and told you I would explain to you about the mineral water, do realize I make no recommendations for supplements other than B12. And I certainly don't recommend any products. And what I'm going to show you right now is some information that you may want to take advantage of. But it's not part of the McDougall diet or recommendations. But I think it's worthy of knowing. And I think it's safe. And I think it's reasonable. So I told you that there's another way to get rid of aluminum from the body. And that's to consume silicone. And what I talked to you about, and I gave you the reference, it's the end of the June 2017 newsletter. It's right there, a link. Boom, you just hit it, takes you to a daily news article, and you can read this about the investigator, about the silicone water. And you can read about two sources. This is a British article, two sources of mineral water that they discussed that are easy to buy in the United Kingdom, the United States, probably any place in the world you can get it. And there are probably lots more sources of silicone-rich water. Silicone-rich water is what it's called. Here they are, the two that I discussed in the article. Again, I don't recommend supplements. This is not a, quote, recommendation, official recommendation from McDougall, so to speak, new part of the McDougall program. But I do think that you would like to have this information. Or probably other silicone-rich waters. And people have asked me about taking silicone powders and silicone this and silicone that. Maybe, I don't know. You investigate it. But one of the waters is this, Fiji water that they talk about. Yeah, I've seen this in our stores. And I know you can find it on Amazon, and I know you can find it pretty much any place. And this delivers silicone, which complexes the aluminum in your tissues and causes it to be eliminated through the kidneys. And significantly so that it was measured in scientific studies to be effective at removing aluminum from the body and in the small, and I mean very small, study they did on people. They slowed the progression of Alzheimer's disease in a few. It's all in the newsletter. Just read them. There's another one. Okay. Fulvic drinking water, high in silicone. And there are probably lots of other sources of silicone that you might want to add to your diet. Yeah, and you can do that. But certainly you don't have to get Alzheimer's. If you have it, you can do something about it. Whereas there's no medical treatments and there are no drugs that are sold through doctors or pharmacists or any other legitimate source that'll change the course of this disease, except for removing the aluminum from the body, which was shown back 1991 with desferoxamine injections. And this author, which you can read lots about, very respected scientist, he's recommending silicone water. And I thought it worthy of me telling you about it. So hopefully that will be the end of the discussion for Alzheimer's for another 13 years. I'll give you an update in 13 years.
Okay. Well, that is very concise.
So anyway, I just want to address one more thing, Gustavo, and hopefully everything's coming across okay. I just want to address one more thing, and that is the July 2017 newsletter, which came out yesterday, which was 2 days late. It's because you and I took a vacation, and I couldn't keep my mind oriented in two places at one time, and I chose the grandkids over the article. But I finally did get to it when we got home a few days ago. I finally got to the newsletter, which was also prompted by Carol. Carol answers the phone when you call 1-800-941-7111. She takes care of our, all of our telecommunications in terms of phones and signing people up for this and that and so on. Carol and I were together with Mary and, like I say, our 3 children, 7 grandkids. And Carol said the same thing that I come across every day, and that is that we get emails from some of you, and from a lot of your friends, emails that ask me and phone calls that ask Carol and emails that ask Carol to justify our recommendations over other people's. Yeah, you asked me to do that. Excuse me, I've written 13 national best-selling books, probably 150 newsletters, and done maybe 180 videos talking about things. And you asked me to compare what I've done, and ideas, by the way, which I established 40 years ago, compare and justify what I suggest over the whatever diet, lectin-free, low carb, who knows? There'll be a new one out every day. You asked me to do that. Well, I'm not going to do it. You know, you can read what I've written. I gave you 4 experiences to look at that I had back in the 1970s and understand them before you ask me such a question as to, is this diet better than your diet, Dr. McDougall? And you must prove to me that it is better or I won't follow it. Well, you know what? It's not my loss. So I wrote this newsletter, the July 2017 newsletter, to help you understand why I am either stubborn or right, and continue to teach the same things that I taught 40 years ago without variation. Now, there are other doctors out there. Mark Hyman comes to mind, a few others, diet gurus, who add or change to their philosophy every few months as a new diet is needed to sell more books, more products, etc. I haven't done that. Like I say, either I'm stubborn or I'm right. And I end that newsletter of July 2017, well worth your trouble. I ended by saying you ought to do 2 things before you ask me to justify my recommendations over who's ever are on Dr. Oz show or in Women's World magazine at the checkout counter at the grocery store. I ask you to do 2 things before you ask me such a question, which distracts me from helping you with information I know to be correct, which we've published on at least 2,500 people in the scientific research. I ask you to do 2 things. Now, again, I don't mean to be critical or condemning to those of you who don't have this issue of and requirement in me justifying for you behavioral changes. I ask you to do 2 things if you're in any quandary. One is try the McDougall diet. 4 weeks enough. Just try, strictly. And 2, in that July 2017 newsletter, I gave you 4 experiences that I had in the 70s to ask you to live. You can do it by listening to lectures by my mentors, reading some of their research, reading again my experiences. Just take that time. And then say, well, Dr. McDougall, I think you're missing something. You know, it's really not the meat and the dairy and the ice cream. It's GMOs, or maybe I'm gluten sensitive, or too much lectin in the beans, or you won't ask me that. My time is more worthy than getting into arguments that do no one any good. So what Carol's going to do now, Carol, you know, when you call 1-800-941-7111, what Carol's going to do now is she's not going to try and help you understand why our recommendations are better. She won't do that anymore. She's going to ask you to read the July 2017 newsletter. Yeah, that's what she's going to do. And when you write me, as you do every day, and you ask me to justify what I've recommended consistently for 40 years over this brand new diet, which sells lots of new products and explains to you why you've not gotten better by this new finding. It's time about a brand new finding. It's the answer. Before you ask me that, I'm going to ask you to read the July 2017 newsletter. And you should hand it out freely, mail it to anybody who asks that question, and feel like you can sit back and enjoy your health and get on to other things and not have to spend your time proving that what you and I have known to be right, to be highly effective, is correct. End of topic. Okay, so
very good.
You are having a good time in Argentina with your family. We're back with our friends and followers and family and crusaders and everything. And are there things on people's minds? Oh, one more thing. I read an article today. I guess somebody sent it to me on the internet, which I thought was kind of interesting. And that is that if we were to substitute beans, everybody's worried about protein. Beans are high in protein, which of course is complete nonsense to worry about protein. If we substituted beans for beef in this country, that we would make more progress in reducing climate change, global warming gases than any other single thing we could do. I thought that was pretty cool. You go to Taco Bell and you get beans, not beef. You find new menus. You find dietitians and our government and world leaders saying, hey, folks, saving the planet is worthwhile. And the fact that some very rich businesses and people are going to fall a little short in their profits, a little bit, over the next 10 years. We got to say, look, there are more things important than whether or not the stocks go up and your businesses show great profits. There's something called your personal health, saving the planet, a few things like that. And anyway, I saw that today. I just thought I wanted to share that with you too.
Yeah, and honesty and integrity, like you have, Dr. Michael.
And in Argentina, do people look any different than Americans in Texas, say, for example?
They do, actually. Of course, now with the knowledge that I have, I'm looking around and what people do and eat. And even though this is there are a lot of meat consumed here, but people are getting more and more aware of that is a problem, and they are looking for the right information. And they walk a lot, so you don't see a lot of obesity. You really don't. And they do eat a lot of fruits and veggies, but it's still not the McDougall diet. And we need to bring this information to our Spanish-speaking world. I think you and I were talking a little bit about that the other day.
Well, I have very limited experience with Argentina. Mary and I were there about 15 years ago. But prior to that, back when I first got interested in diet back in the 1970s, it was well established that colon cancer was most common in Argentina of all countries in the world, because they're some of the most heavy beef eaters in the world. So even though they're not like when I went to the store every day in Michigan last week, or I will go out this afternoon in California, it may not be that 8 out of 10 people are struggling because of their obesity, as they are in the U.S., overweight and obesity, but Argentina and the rest of the world, they'll be there soon. Yeah.
Oh yeah, yeah. And I think I mentioned to you how a relative of mine went to the doctor 2 days ago, and it's just appalling to see that it's the same type of industry now everywhere. My aunt went to. She had a little spot on her skin, and she was deferred to a dermatologist, to an endocrinologist. She was asked to have a bone density exam and a thyroid exam, and she was told she had about high blood pressure and cholesterol, and it's just crazy, insane. Anyway,
Some might think it's unstoppable, but not me. I couldn't get up every morning with that attitude. I must get up every morning with the attitude. Today we're going to find another way.
yeah.
And I see so many other people. I mean, I get really interesting articles, YouTubes from many of you by email. You all know that I answer my own email, showing just a large number of doctors and dietitians and other really, really smart people that have come to this understanding, are taking action. It's a matter still of the truth, not the alternative truth, but the real truth outweighing the money. And right now that doesn't happen. Hopefully we can get the army large enough, that's us, that we can make a difference. Yeah.
Mm-hmm. Yes, I agree. And I want to encourage everybody to go and get your newsletter from your website. They're free and it's a wealth of information. So I think I put a link there already for them.
Did you? Thanks. And the webinar, this one.
Well, we have now a collection of webinars that is quite large.
Are you able to see? I mean, a lot of people.
Yeah, and I have a lot of questions, Dr. McDougall. I don't know if you want to take some of these questions.
On the chat, she identifies the researchers. I talked to you about. You guys are really with it. Oh man.
Oh yeah, they are. They are. So, is it okay if I ask you a couple of questions, Dr. McDougall, that people sent in?
And let's see. Okay. Yes, please.
Well, I have someone that asked that my father has dementia, not Alzheimer's. Is diet also a factor with dementia, and what is the difference between the two?
Okay. Dementia just means loss of mental function, probably to the point of disability. And there are several causes. Before, what I tell you, there were 37 cases of Alzheimer's, 37. Now there are 24 million in the world back in the 1930s. So Alzheimer's was essentially unknown. Louis Alzheimer, he found the first case in about 1901, published it in 1911. So Alzheimer's is a new, but probably the most common form of dementia. And that's due to aluminum poisoning. It actually poisons, it accumulates in the brain. It's particularly high in concentration in areas of the brain that are found to be diseased in Alzheimer's. So it's due to a direct toxicity. You would think of it in terms of things like other heavy metal poisoning, such as mercury poisoning or arsenic poisoning, et cetera. I mean, it's a poison that accumulates in the body, which destroys the brain tissue. It has nothing to do with blood vessels, or very little to do with the blood vessels. And let me just...
You are perfect.
Okay, great. Thanks, Mary. Mary's watching us, Gustavo. Make sure we're doing okay. So anyway, there's this kind of poisoning. You can get dementia from an auto accident, and brain trauma. The other very, very, very common form of dementia is vascular. The blood vessels, just like when you have a heart attack, or you become impotent, or your leg blood vessels close down, you can't walk because of pain and claudication. This is a disease of the blood vessels, not just the big blood vessels like in the carotid artery, but the little blood vessels that supply the brain tissue. And you can think of it as mini strokes or vascular insufficiency, so you don't have enough blood going to the brain to make it work well. And by the way, that can be reversible by improving blood flow, by fixing the diet. But most of the time it's due to little strokes or big strokes, which result in permanent damage that's not reversible. So there are a couple of things. The main thing to consider when I tell you this is not an inevitable part of aging. These diseases have causes. It's not due to bad genetics, except in rare, extremely rare such situations. And the same approach, which costs nothing, which reduces your food bill by at least 60%, the same approach is available to you. Eat a good diet, breathe clean air, clean water, walk around a little bit. So when you say, I don't want to get demented, I don't see anything more fun about getting demented from aluminum poisoning or getting demented from several thousand or one stroke. I don't think either one of them are fun. I mean, I personally had some experience with the stroke part, but yeah, it's up to you. It's totally up to you with proper information to avoid both common forms of dementia. Wear your safety belt when you're driving a car so you don't get a head injury. And, it's unfortunately unprofitable for you to hear this. So when I invent, and by the way, I'll give you 10%, Gustavo, when I invent the pill, which you can take and still consume bacon and cheese and beef burgers and get great health, then Gustavo, you and I can retire. And these people, everybody, nobody has to worry anymore about the food. But you still have to worry about destroying the planet. But heck, right now it's okay. So we can wait 10 years to do that. Anyway, yeah.
You know what? Now that you mentioned that, Dr. McDougall, I was lucky. I had never traveled to the southmost point of the earth, and I was lucky to be able to go to Ushuaia, which is the southernmost city in the world. You almost fall from the earth when you're there. I was there last week, very, very cold, and I took a taxi, and the taxi driver said that. I didn't ask him, we were talking about something, but he mentioned that he had grown up there. He was 25 years old, and he said that every winter is getting warmer. Oh. And that comes from a person who was born there. And, it's something that they were making artificial snow up in the mountains when they're supposed to have enough snow for skiing in the Antarctica.
Yeah. Well, yeah. Mother Nature doesn't care whether the dairy industry gets a profit this year, or the meat industry doesn't even care if nature doesn't even care that the biggest hospitals, the most beautiful buildings or the most beautiful, biggest buildings in your town are hospitals. Mother Nature doesn't care, I don't think. So regardless of what you, whether you live in the southernmost part of the world or you own Amazon.com, it doesn't make any difference. She's got her plan.
Yeah.
But a lot of people, but the optimism is there. Gustavo, I see it every day and I read about it. Elon Musk and his electric cars and the changes that are made in terms of solar power, they're all there. But until we grasp hold and do something about the food, we're done.
Yeah, especially the United States. We're People have their eyes. I mean, we're supposed to be some of the leaders.
Yeah. Yeah.
Yeah.
Okay.
Well,
Anyway,
Dr. McDougall.
I spent last week with my 7 grandkids and had a wonderful time. And they're all and they're all healthy, and they're all, God, it was a great week. I guess I should just be happy with that.
Yes, you should. It's a gift you have.
With your daughters last week.
Yeah. Yes. And we'll be there next week. So.
But we're not going to stop trying to fix things.
We're not going to stop. No, there's no way to get rid of Dr. McDougall or Gustavo. Yeah.
Okay. Well, do we have?
Okay, so we have a couple of people asking how much silica-rich water and for how long you think they would need to take this in order to get rid of the aluminum in their bodies.
You know what?
Is it I don't know.
I have no answer for that because that is not my expertise. But if you read the newsletter, you can go to the research from England, and he will say things like he'll give you the content of these 2 waters, silicon content, in that particular link that you can get on the June newsletter. He'll give you the silicon content. He will tell you about his research that's published in the scientific literature on giving 1 liter per day. That's what he gave. 1 liter per day of silicon water, 34 ounces. That's what he did. And the results that he got are easy for you to look at. And I don't have any recommendation because I'm not an expert on it. But it's safe enough, simple enough, cheap enough that I thought you should know about it. And if you would like to go to an expert, I've linked it for you. And you know how to use PubMed, and you know how to use Google, and you know how to spell silicone-rich water, and you know how to spell Alzheimer's. And in today's world, everybody can be king of knowledge. They can't fool you anymore at the present time. So, yeah, I can make no further recommendations on that, but I'm happy I could give you the information. I'm real pleased, as I see on the chat board, that others of you found the researcher, found the information, and you make your own conclusions. As far as I know, either of these waters as much as you want, as far as I know, or similar silicon waters, has never hurt anybody.
Yeah, I think that a lot of people are used to getting the information, handed to them. But in our world today, it's there, like you said, it's available. We just have to put in a little bit of time. I mean, you've put in 40 years of work and research, so I think it's fair that you ask of us to read the research, some of it at least.
Yeah, correct.
Yeah,
and we of course, as all of you who have been longtime listeners, we provide a website, pretty much commercial free, free to you, that offers everything you need, all the way from a simple color picture book, so you don't even have to read, but it is in 22 different languages, to all the things that I've written and Mary's written, and hundreds and hundreds of recipes. And I guess the last thing I could do is come to your house and cook for you, but you wouldn't want that, because all I know how to cook is potatoes.
Dr. McDougall, should people be concerned about some of the aluminum that is in some of the vaccines that we get?
Yes. And I wrote a whole article about 2-3 years ago on why I recommend against taking the flu vaccine. But all my grandchildren are vaccinated against pretty much all other diseases. So I do believe in vaccination. However, in that particular article, I discuss the mercury, which has been eliminated from a lot of vaccines. And I discuss aluminum, which is there as an adjuvant. Its purpose is to make your immune system react, so that it reacts with the antigen, which is the virus or bacteria that you're trying to be immunized against. That's injected into a killed or inactive form of, say, diphtheria, pertussis, etc. It's injected into you, and your body is supposed to react to that particular danger and make antibodies, so that if you do get exposed to the real microbe, it'll be ready to fend off and not get sick because the immune system has been educated. Well, to help educate that immune system, you want a big reaction from the immunization, from the shot. I mean, you really want the body to know you did something to it. So they put aluminum in, which causes the immune system to react, and not just to the aluminum, but to the intended microbe part that you injected. So yeah, it's in all vaccinations. It's my plea, as well as the plea of most other physicians and patients, is to design vaccines that are aluminum-free, safer. Yeah, really. It's been a topic for 4 decades at least that I'm aware of. So yeah, you should be concerned. But just to summarize, I've seen diphtheria, I've seen polio, I've seen tetanus. These, even though you've not seen it probably, unless you're of my age and similar experience, these are real killers. So I have to ask myself, concerning the welfare of my family, am I more concerned about the diseases that are being fought against with vaccinations, immunization, shots, etc., or the aluminum? And since I have, just like you, no choice, I mean, you have a choice, but not a safer choice. All of my family's been immunized except for the flu vaccines. And if you go to the website, use the search engine, you write in flu shots, there's an entire article I've written which does not need a word changed. And so flu shots are not in my personal family's program. Whether or not you do them is kind of up to you. Again, I'm not an expert on immunizations, benefits, alternatives, etc. But I do know enough and am concerned enough that I wrote you what I believe to be true about flu shots. And you hopefully you can look back and say, whatever you've done, you've made the right decision.
Right. Ultimately, falls in our decision. Well, Dr. McDougall, thank you for being here today. I apologize because I know there's some noise in the background, and I'll be back in Texas next week, so I'll be back in my usual environment with no noise.
You and I try our best, Gustavo, and certainly all your efforts are greatly appreciated by Mary and I and the rest of the McDougall program. Perfection is something that I've given up as a goal, and I hope people enjoy the webinar, etc. And thank you, Gustavo, and I look forward to seeing one of your daughters and you in less than 10 days. And
Yeah.
We're sold out.
Oh, that's wonderful. That's wonderful. Well, thank you everyone for logging in. And next week I will be here with Dr. Lyle.
In our more technologically friendly environment.
That's right. All right. Well, thank you again, Dr. McDougall.
And this webinar will be
yes,
published in probably 24 hours on the website for free. And I'll be with you in 2 weeks, and you'll be with me. So let's do it live from the clinic. Maybe we can sit together. We'll find
that was fun.
Nice scene maybe
Yeah.
by the pool, or maybe in the dining room with all the good food. You and I would just kind of sit together and
Eating
just,
some mashed potatoes that Mary makes.
the food is fun.
Yeah. All right. Very good.
Okay, well, have a
Thank
good
you again.
time. Have a good time with your family, Gustavo, and thanks.
You too.
Okay, bye,
Thank you,
folks.
everyone.
Thanks for
All right.
listening. Bye-bye.
Okay.